Welcome, everyone. We're so excited that you can join us. We're going to give folks a couple minutes to join. We've had a few technological difficulties this morning with the link, and so apologies for that if any of you all had any issues or delays, but we are here now and so happy to be with you and really excited to talk more about NTTAC, provide some time so that you all can learn a little bit about us and so we can learn a little bit about you. And so as we get started and get into some introductions, we'd love for you to pop your name and location and your maybe your grantee name in the chat so that we can see who all is here and get going for some good discussion. Go ahead, Victoria. Okay, so welcome again, everyone. My name is Suki Steckel. My pronouns are she, her, and I am a senior technical assistant specialist with NTTAC, which, as you all know by now, is the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health. And I'll talk a little bit more about CARS, who is the organization that I work with, and when we kind of get to our partner section. But I have been involved directly in systems of care and CMHI grant work since 2007 in a variety of capacities. So really excited to bring that experience to you all and to this conversation and to our work moving forward at NTTAC. And I'll go ahead and pass it to Victoria.
Hi, everyone. I'm Victoria Eckert, she, her pronouns. I am a technical assistance specialist here at NTTAC. I'm also the associate director at Youth Move National. And like Suki, I've been directly involved in systems of care work. A little bit later than Suki, I started in 2008, actually as an intern in my local community for a rural system of care community. And then throughout my time, I did some youth engagement work, some community collaboration work, suicide prevention coordination for about 13 years, and then ultimately ended up as a project director for our system of care grant. So really excited to be here with all of you, sharing this space, and really the opportunity to learn from one another. So thank you.
Okay, so if you, oh, we have subtitles. Okay. Are you doing that, Victoria?
Go ahead,
It's
Suki.
okay. So if you have participated in an NTAC event before, you have seen this disclaimer, which is essentially saying that all of the views shared here today are those of the speakers and the presenters. So Victoria, myself, the rest of the team, and all of you, and not those of SAMHSA, our funder. And we do not anticipate any security issues, but should there be any, do not worry. We'll just go ahead and close the Zoom room, and then you'll get an email with a new link to join. But as I said, we don't anticipate that. So as I mentioned today, the purpose of this open house is really informal. We're just here to share a little bit more about NTTAC, who we are, and how we can support you as brand new grantees. Or maybe continuing grantees from previous funding opportunities. So we'll share some things, kind of some bigger high-level events and upcoming events for year 4 that we wanted to just make sure you had on your radar. And then you'll get to hear from each of our partners. And then we will open up the floor to learn more about you as grantees and how we can support you moving forward. Okay, so just a little bit about us. Thanks. So as I said, we'll learn more about the partners in a minute, but I love this slide. You'll see it often as you join our events this go round. And so this is a great overview of the partnership of NTTAC. So NTTAC is not in and of itself an organization. It is a collaborative and a partnership between these 8 agencies, and CARS, the Center for Applied Research Solutions, is the prime on the NTTAC TA Center. And so we kind of are the hub for all publications and event logistics and things like that. So we kind of keep the ball rolling and keep everything in the air and moving forward. And then we partner with these wonderful partners who you'll hear more from here in just a few minutes. So a little bit about our vision and services at NTTAC. Our vision is that all children, youth, and families living with and impacted by mental health challenges will have access to the resources and opportunities they need to thrive in a comprehensive and equitable system of care. And in that vision, we really are your partners in this work. So we really look to CMHI grantees to hear directly from you all, because you're doing the work in the field. We all have a lot of experience from kind of past implementation opportunities, our work in state and local and federal level policy. And so we bring all of that experience to the tables to support you, but we really see you all as leaders in this work. And are here to kind of walk with you on this journey. And so we support you through things like individual training and consultation, which you all are able to receive free of charge from us. There's just a kind of a quick link. You can submit a request. We'll talk more about that in a bit. We have peer learning exchanges, customized coaching, communities of practice, a lot of communities of practice, lots of kind of webinars and learning series, and we're getting into podcasts. And so you'll see those coming out over the next year. We're really excited to launch kind of a more creative way to share information and kind of learn from one another. So we would love to stay connected with you. There are lots of ways to stay connected with us. The ntacmentalhealth.org site has a great kind of overview of resources that you can connect with. You can search for past kind of webinar recordings or publications. We're constantly updating it and kind of trying to find new and innovative and better ways to kind of get information out there to you. So if you have not yet signed up for our newsletter, that is the best way to get information directly from us and stay kind of in the loop with upcoming events and being able to register for things for your staff and your team and your community partners to learn more. So there's you can also submit TA requests through our website and stay connected with us on social media. So if you're not following us on any of these socials listed here, please go ahead and follow us. There's all kinds of things that we post on there over time, and love to connect with folks on social. Okay, so we're going to talk about a couple of highlights for year 4 that we're excited to share. So the first one is a really, really exciting resource and initiative that has come about called Amplify Youth Voice. And I would love to ask you all to jump in the chat and let me know if you have seen this, any of the announcements over email or social media about Amplify Youth Voice, or have you kind of watched any of the videos or checked out the information on the website. So I'll just give you all a second to hop in the chat, and I'm just kind of curious if anybody who's on the call today has seen this. And so as you all are doing that, I'll tell you a little bit about it, and thank you for popping the link to the website in the chat. So this really is kind of a very layered initiative. It's sort of art within art within art. And we at NTTAC collaborated with a local organization in Nashville, Tennessee called Southern Word, which is a community-based organization that has 15 years of experience in mentoring and supporting young people, young adults, high schoolers and middle schoolers through education curricula and partnerships with mental health programs and things like that on spoken word, poetry, songwriting. And so we partnered with them to support 10 young people through a series of writing workshops this past summer. And so they were kind of selected to write about their own mental health challenges. And then the team at NTTAC selected 4 of those 10 young people to go to Austin and record their spoken word poetry in a professional studio. And so we produced those films as well as an introductory video with some of our partners that really kind of explained some of the important aspects of making sure that you're, as a system of care, that part of your continuum of supports and services really kind of leans into some of these maybe kind of atypical or not always thought about kind of creative arts community organizations and how critical they are to meeting the needs of all of the young people that we serve. And so we're really excited to put this information out there. We ask that you kind of share this and really we're going to be working over the next year to provide kind of some tips and resources and host some live events so that you can learn more about this process and how you can maybe replicate it in your own community. And if you can jump to the next slide, please. And also, especially, we're highlighting a call to action. And those are the 4 poets. If you haven't seen the videos yet, those are their pictures. They're absolutely extraordinary young people. And so we're going to be working on some resources and tips to support the call to action, which is kind of 4 different pieces, listening to young people, expanding opportunities for creative expression and why that matters for mental well-being, and championing youth leadership, which is a key and kind of a required activity for you all as grantees, and of course, uplifting youth voice and policy advocacy. So we're really excited to roll out kind of expanded versions of some of the work that we've laid the foundation for. Okay, I'm going to pass it over to Ashley Singleton, who is our fearless leader with the System of Care Summit, to tell us more about what's coming up in May.
Hey there, everybody. My name is Ashley Singleton. I'm a senior project manager at NTTAC, and I wear many, many hats. And one of those hats that I wear is coordinating our annual System of Care virtual summit. This year, it's going to be held on May 14th through the 16th. This is a no registration cost at all, virtual summit open to anyone who is invested in mental health and wellness for children, youth, and families. So there are a lot of benefits to the summit. We're going to have over 30 speakers and presenters and keynotes. There are no cost continuing education hours available, multiple networking opportunities available. So if you haven't already registered for the summit, go ahead and do that. Check that off the list. That's the easy thing on the to-do list, right? So register today, and please also share with your network, share with your colleagues, share with your friends, the people that you serve and the communities that you serve. Please help us uplift the summit. And another thing that we have going on with the summit, which we're really excited about, and on the next slide, you'll see more information about our System of Care champions. So these are awards that we give to honor the actions of individuals and organizations within the System of Care network that support mental health and wellness for children, youth, and families. You can nominate someone that you feel is deserving of this award. We have nominations open until February the 7th, 11:59 Eastern, 10:59 Central, 8:59 Pacific. So please be sure to check out more details on our website about the eligibility requirements for nominations and the different awards that we have available. The form is super easy to use to nominate someone. So you have a couple of days left. If there's someone that you like to nominate or even nominate yourself, we're accepting those as well. So we look forward to seeing you at the SOC Summit later this year. And let me know if you have any questions. All righty.
Thanks so much, Ashley. Yeah, we'll have to. Okay, thanks. So the summit is really important that Ashley just talked about because it is free, as she said. It's really comprehensive. It's virtual, so it's really accessible. We pay a lot of attention to making sure you all have access to information. The platform that we use is really interactive, and so we've kind of heard from folks that it's like the next best thing to being in person. And so we kind of counterbalance the summit with this CMHI grantee meeting, which is coming up in July. And this will be our second annual in-person meeting that we partner closely with SAMHSA as your GPOs to host you all as a team in the Washington, D.C. area. And so this year, save the date, we just finalized this week. You'll be getting an email from your GPO here probably in the next week to 10 days with more information. But this is a little preview since you joined us today. That is happening. So the meeting is the week of July 15th. It's going to start on the Tuesday of that week, which I think is July 16th. Through the Friday of that week. And I apologize, I don't have the exact dates. So Carrie can drop those in the chat here in a second. But it is that week. It'll be in Bethesda, Maryland. Again, you'll be getting more information about the hotel and how to register and things like that. So the thing to know now and to think about with your budget and your planning is that you're going to be asked to send teams of a minimum of 2 and a maximum of 4. And the project director and lead family coordinator positions, which are your key staff, of course, for your grant, are required. And then we are strongly encouraging your youth coordinator and evaluator to attend as well. And of course, you'll be getting lots more information about this, but this is just a kind of a headline to just let you all know that this is coming. And we will have another meeting in person in 2025 in July, likely kind of similar time frame and location. So to kind of summarize, the required meeting is, required for the teams, and then the summit is open to all of your partners, all of your staff. Really would love for you all to register for that. It's an extraordinary event. We hear it's really good. We get lots of good feedback, and that this year will be it's our 3rd year in a row, I think, Ashley, we've hosted the summit. So it's definitely a good time. So I know some of you all as new grantees are part of tribal communities or tribes and have specific experiences and needs. And so we are excited to be partnering with Dawn Yazzie and Shannon Crossbear as our kind of facilitators for providing individualized and kind of collective support for tribal grantees. And so just know that if you haven't received an invitation to participate in a co-creation group to kind of come together and connect, to kind of help, especially with last year at the 2023 CMHI grantee meeting, we hosted a tribal grantee kind of only meeting that the grantees helped to plan. And so we want to do that again this year. And so if you haven't received information about that and you are a tribal grantee, know that it is forthcoming, and we're in the process of kind of connecting with the folks who were there last year and then opening it up to new grantees. So just know that is happening, and more information and details are forthcoming. And please feel free to reach out to us if you have any questions about that. Okay, so now we are going to chat about we're going to kind of go through some partner spotlights, and we'll start with CARS, as I mentioned, which is the Center for Applied Research Solutions. The folks that you see on the screen here are our team members. And so Tracy Levins is our project co-director, And I think she's on, and I'm going to ask her to just say hi real quick to folks. So she's co-director with Neil Horan on the center overall. She's where she was.
Tracy couldn't make it today, but accepting her award.
I really thought I saw her log in. Okay, so she is in Austin, Texas, and really excited that she joined our team full time last year to be our co-director. She brings a wealth of experience, especially in juvenile justice, and does a lot of our kind of visioning and support for our partnership overall. I have already introduced myself. So has Ashley Singleton, who handles a lot of, not like she said, she wears lots of hats, not just the summit. Carrie DeSalle is a project manager extraordinaire and handles a lot of the kind of back end logistics and planning for our events, especially our CMHI grantee meeting. So you all get to meet the team when you come to Bethesda in July. Bridget Okayu is our project coordinator and provides support for the center overall. And Karina Joyner is our very newest staff member, and she is a research associate part-time on NTTAC. And just a little bit about CARS for those of you all who may not be familiar with us. We are a California-based nonprofit, but support training and TA across the country, pretty much across the whole entire spectrum of behavioral health, so substance use and prevention, and as well as mental health and children's mental health in particular. We're based out of Santa Rosa, California, and our mission in general is to promote policies and practices that are equity-driven, evidence-based, and culturally responsive, aiming to reduce health disparities and promote equity. So we really have equity as a driver in pretty much all of our projects. And if you have not seen kind of the calendar of events for NTTAC, you'll see that equity is something that is prioritized across pretty much all of our events. And so I will turn it over to Elizabeth Waitzig with Change Matrix.
Thank you so much, Suki. It is our pleasure at Change Matrix to be longstanding partners of CARS. We've served on, I think now, 5 technical assistance centers with CARS, and we really appreciate the partnership and really appreciate this project here at NTTAC. I'm just going to quickly introduce to you my colleagues, even though they weren't able to be here today. First on my team is Gia Kelly, and Gia Kelly is the Director of Transformation Teams for NTTAC, and she also serves on the JEDI Council, the Justice, Equity, Diversity, and Inclusion Council for NTTAC. And she's been very active in ensuring that equity is woven not only throughout our products and services, but also our center, because we want to make sure that we are walking the walk. So Gia is really helpful with that. And then we have Evelyn Clark, who joins us as a wonderful peer support, certified peer support partner, and also is very invested in making sure that mental health is not only woven into juvenile justice, but woven into a way that is equitable and serves individuals from all races and ethnicities and sexual and gender orientation and age and religion and everything else. So we're very grateful for Evelyn's participation in the center. Cindy is a newer addition to our team. She is a TA specialist and with Change Matrix, and she brings she's a military spouse. She is also done a lot of work in school mental health, and she practices culturally responsive and equitable evaluation. And so she supports our evaluators in ways that are participatory and in evaluation approaches and methods that are designed where we partner with those most impacted in the design of that evaluation. So we're very happy to have Cindy on this team. If we can go to the next slide. what I put up here is a little bit about what Change Matrix does and how we do it. So our vision is that communities are equitable, inclusive, and resilient, supported by integrated and collaborative systems. That sort of sounds like system of care, doesn't it? That's what we're hoping for. Our mission is that we motivate, manage, and measure change for systems and communities. We partner with clients to identify the focus of change while challenging racism and other isms to lead towards justice. And so we know that in these complex systems and the work that you're doing, it's all about change, because we can't stay where we are in order to achieve the kinds of communities that really effectively serve all of our young people and their families. What you'll see in this flower is that all of the ways in which we do that. And so everything from the kinds of the processes, so coaching and facilitation, data visualization, to the topical areas, trauma and resiliency, primary care, mental health, juvenile justice, to the ways in which we do that. We have a strong focus on adaptive leadership, and of course, equity, diversity, equity, inclusion, justice run throughout every single thing that we do, including our own company. And then on the next slide, our last slide, I wanted to introduce you to our TA values, because we work on a lot of TA centers, and we've developed a way of being in this technical assistance space that is grounded in anti-racism, equity, and justice to inform all of our processes, but is also built on the relationships. We believe that you are the experts in your community. You are the experts in the care that you provide, in the way in which you build your systems. And we believe that we can be the most effective when we are in relationship and partner with those that we serve. We recognize that you recognize and celebrate the strengths of your community, and we recognize and celebrate those strengths as well. We will always center the voices and experiences of those most impacted by the work that we're doing. We really want to create a balance when we're in TA relationships, so that we're holding space to deeply listen to you all, and that we're also asking powerful questions, because we hope that our work together will lead to transformational shifts in all of our perspectives. And we also believe in an emergent learning process. We know that even if we think we've gotten to a destination, we're going to have to go again at some point. And that's based on learning and reflection and evaluation. And then lastly, we're committed to adaptation and sustainability. This is a really, really difficult body of work, and we want to be supportive in terms of what's working, what's not working, but not just for right now, but into the future. Our hope is always to work ourselves out of a job. So far, there's still a TA center and there's still Change Matrix, so there's work to do. I just want to end by saying our little piece about Change Matrix by saying we are honored to be part of this TA center. We are so appreciative of your time that you took to learn about the TA center, and we look forward to seeing you in the future at one of these many, many events that NTTAC puts on. And Suki, back to you.
Thanks so much, Elizabeth. I'm going to turn it over to Millie Sweeney with Fredla.
Thanks, Suki. Hi, I'm Millie Sweeney. I'm the Director of Learning and Workforce Development for Fredla. That stands for the Family Run Executive Director Leadership Association, which is a mouthful. Our team is also honored to be part of the Technical Assistance Center. And Pat Hunt, who is our Executive Director, wasn't able to be here today. She's actually traveling to Omaha to do some policy work. So that's where she is right now. Lori Sarar is our liaison to family organizations. She also operates and facilitates the family exchange, which is something that is offered through NTTAC that I hope you would consider being a part of. Shannon Crossbear is part of our team. She is one of our consultants and has years and years of experience in evaluation, in doing all sorts of things through system of care. And she brings the tribal voice to the work that we do. In Fredla, we are all family members. All of us are parents and the primary caregivers of children and youth that have emotional and behavioral and sometimes co-occurring challenges. We live throughout the United States. I'm here in Middle Tennessee. Pat is in Maine. Lori is in Utah. And Shannon is up next to the Great Lakes, up in the cold area. We also have Ryan Brackley, who is kind of a behind the scenes person who handles a lot of our administrative stuff. She also is a family member. We all have been involved in administration of family-run organizations in some capacity. I apologize, I'm losing my voice. Next slide, please. So right now, we're the only national association of family-run organizations that are dedicated solely to child and youth mental health. We address cross-system challenges, co-occurring disorder, and together, our team has a combined 117 years of experience in systems of care. We started adding that up this week, and we were like, oh, okay, so I don't know if I feel old or experienced at this point. We've helped implement a number of iterations of National TA Center contracts. Our role in those TA centers is to make sure that the family lived experience is infused at all levels of what we do, that it drives the training and the technical assistance and the different resources and products that come out through NTTAC, and our individual expertise is applied to the solutions that are come up within the TA Center. We work collaboratively with all the other partners. You can see on the slide here, and I think everybody gets a copy of this, there are some upcoming events. We are going to hold kind of a homecoming for lead family coordinators on February 14th at 3 p.m. Eastern, and we hope that you will invite your lead family coordinators to be a part of that so that we can introduce ourselves, find out where you are in your site, how we can possibly be of help with that particular role, which is absolutely critical in these grants and in building a coordinated system that cares. The Family Exchange I mentioned a minute ago that Lori facilitates. It's a place for you to come and learn about how to do family-driven care, how to infuse family voice, how to partner with families. It has a rotating list of national speakers, and there's always sharing of resources and strategies and a time to network. Coming up soon, we have the Parent Peer Support Institute, which is a virtual 3 days, half days. It's from 1 to 4 p.m. Eastern each day on all things parent peer support. We are switching up a little bit this year, and we're starting off each day with a conversation that's the theme for the day. And then we are going to have 3 workshop tracks, one for parent peer support providers, one for supervisors and about programmatic issues, and the third one is for policymakers, funders, administrators. And so all the registration links are in there if you're interested. Next slide, please. Thank you. This is where our work is. It lies within and among these 5 areas. They overlap, they intersect. We work with family-run organizations. We help develop training and resources. We support capacity building for family partnership through all of these different ways. Through targeted training, materials like organizational readiness. We do training for parent peer support providers, for supervisors. We do board development. We help in the area of research. We're often a connector of researchers and family leaders and family-run organizations. And we have a number of ways in which we contribute to the field in that way, both to the literature and to practice. We also partner with national organizations and other associations like the Child Welfare League of America, like the National Association of Mental Health Program Directors. So our whole goal at FREDLA is to elevate the voices of families and to help people partner effectively with them. And that's our role in NTTAC. So I may have gone over my 5 minutes, but these are the different ways that you can access us. Thanks, Suki. Back to you.
Thanks so much, Millie. And next, Victoria and Shane are going to talk about Youth Move.
Yeah, hi everybody. Again, Victoria Eckert. I am the Associate Director at Youth Move National. And Youth Move National, we are a national youth-led and chapter-based organization, and I'll give you a little bit more info about that on our next slide, but here is our amazing staff to start with. And this isn't everyone, this is only our team that's involved in NTTAC, and here you'll see, of course, as Millie mentioned, Pat is traveling. Our Executive Director, Arc Telos Saint Amour, often goes by their nickname Tay, is also traveling this week as well, presenting on justice, equity, diversity, and inclusion in New York, actually. And so Tay was super sad that they couldn't make it, but Tay has been our executive director now for about 1.5 years. We also have Jasmine Boatwright, who is an NTTAC co-lead on the Community Wellness and Peer Supports team. Shane McDonald is here with us, whom you'll meet in just a couple of minutes, but is a youth program coordinator at Youth Move. Paige Martin is our communications specialist, and then Amanda Grace Greer, who is our youth programs specialist. And so we are just so excited to have our small and mighty team part of NTTAC. So honored to be here with all of you, sharing our expertise and our passion for meaningful youth engagement connection. So on the next slide here, I do realize that this is a lot of words for a very brief presentation, but I am always about giving you more than you will ever need. And being that, I just wanted to give a very brief overview of Youth Move National. Again, like I said, we're a national youth-led chapter-based organization. We are committed to reducing systemic harm and fostering a diverse community where all youth can thrive. And really, what does that mean, right? That means that Youth Move National is involved in community systems in a variety of different ways, whether we're working in partnership with one of our 50+ chapter networks across the country that are led by young people doing that on the ground work, really celebrating those voices of lived experience, influencing those systems, influencing those policies in their local communities, and doing really incredible leadership work. We are also partnering on a larger scale level with universities, doing research around youth engagement, policies and procedures that are affecting youth across the country. We are also engaged in a diverse consulting portfolio, really working with community systems, federal grantees on those youth engagement efforts, from maybe chapter startup to large scale implementation, whether it's including youth in systems change on governing boards, leadership positions, or helping them develop youth peer support programs, and sometimes often across statewide entities as well. And so with that said, I'll let you read the rest of this on your own. You will definitely be getting a copy of this PowerPoint, but there are 2 highlights that Shane and I would like to present to you all today. Okay, so the first one here is a project that we have been offering through NTTAC. We did it last year, and for my opinion, it was really successful. It was a really wonderful experience, not only for me, but hopefully for the attendees. And this is our collaborative learning series for system of care project directors and key leaders. And essentially, this meeting was really to influence that peer-to-peer experience. And being that all of you are new to systems of care, we hope to create this space to bring in those that were new and those that have been doing this work for a number of years to share what the real life experiences are. And so we really thought about what is it like to create this opportunity and this vision of system of care in our communities or in our states. Then what is it like really to implement it? And sometimes what we've learned is that it looks very different from paper to practice to implementation, and then of course sustainability. And so on this slide here, I just wanted to share with you all about that importance of peer-to-peer learning, coming together, sharing those challenges. And of course, we wanted to invite you to learn from grantees that have been doing this for many, many years, who are willing to share their expertise, but to also to support new grantees coming into this as well. And I think we'll share some information in the chat on how to register for the series. And the really wonderful thing about the series is that every month that it is offered, we welcome a subject matter expert to discuss something that is system of care specific. So for example, in January, Suki spoke about governance and how to create and implement a very robust governance that helps drive the work. And then also in February, Lisa Knight, who is on this call from Georgetown University, our co-host for the series, will present about early infant and childhood mental health. So super jazzed about that. Okay. Clicking over, Shane, I'm going to welcome you into the space to tell us a little bit more about this amazing opportunity.
Thanks, Victoria. And hello, everyone. Again, my name is Shane McDonald. My pronouns are they, them, and theirs. And I am the host of our monthly youth and young adult support space. So this is a gathering that takes place on the, as you can see here, right, third Wednesdays of the month from 3 to 4 p.m. Eastern time. And to share just a little bit more about the purpose of this really amazing space on the next slide here. Awesome. So the Youth and Young Adult Support Space, or what we like to call our YAS, offers a virtual learning space for those leading and coordinating youth engagement efforts in system of care and healthy transitions grant communities, as well as others who are working in and leading youth-run programs and organizations. So this includes, but is definitely not limited to, youth engagement specialists, youth coordinators, youth program managers, youth peers, as well as leaders of Youth Move chapters, as Victoria shared a little bit about before, right? And other youth-run programs that engage youth with lived experience in youth-serving systems in change making. So this monthly space is designed for really informal, but also in-depth conversations and connection with peers in the workforce to ask questions, share resources, best practices, challenges, successes, and a space to receive coaching and support both from folks just in community with each other in that space, as well as from Youth Move facilitators like me. So the structure of these meetings, right, we usually start by welcoming in folks and doing some light housekeeping while they get acquainted in the chat, as we have typically over 100 folks join these meetings each month. Then we welcome a subject matter expert as our presenter to share about their work or an important topic in the field, and then end with Q&A in an open space for folks to share successes and challenges in their work and seek some group feedback at large. And I will also say that we've had interest and had youth and young adults themselves join as well. Before I pass back the virtual mic, I'll give a little plug to the one that we're holding this month. So this month we'll be joined by a transition-aged youth peer with the Youth of Utah Advocacy Coalition. Many of y'all may be familiar with this person, Theo Schwartz. They are incredible. And they're going to be discussing their advocacy journey, how to emphasize youth voice, and how to build connections between youth and other partners in young people's lives. And I believe a link to register for this space will be in the chat as well. And with that, thank you. Passing the mic back.
Thanks so much, Shane. I'm going to invite Lisa Knight and Neil Horn to tell us more about the Georgetown University Center for Child and Human Development.
Thank you, Suki. Neil had to step away. He had another meeting, but I'm gonna go ahead and put our website right in the chat. Good morning, good afternoon, everybody. Hopefully, oh, it didn't even load up, y'all. Hold on one second, because I want y'all to have this.
Don't worry, we got it, Lisa.
Okay. All right, perfect. So I'm Lisa Knight, representing Georgetown University. And just a few of the things that we offer in our early childhood center. Of course, our specialty is early childhood education. We focus on cultural competence, developmental disabilities, gender and health, and also clinical services anchored in evidence-based practices. Next slide, please. And so here is our Georgetown team that serves on NTTAC. That was our fearless leader that spoke up earlier, Neil. He is the co-director of NTTAC. And also, he's actually on 7 national training centers, focusing on early childhood education. And he also focuses primarily on infant and early childhood mental health consultation. So excited just to be under Neil's leadership as I've joined the Georgetown team. Next, we have Dawn Yazzie, who is on our team, and she serves in the system of care, implementation, evaluation, and sustainability team. But Dawn is really one of our subject matter experts for tribal communities and also around infant and early childhood mental health consultation. Monica Ruiz, my right hand, oh my gosh, Monica serves in the capacity of the community wellness and peer supports area in NTTAC, but also she's working with me on the fatherhood curriculum, and we'll talk about that and just provide supports in different areas on the project. Dion Coker, she actually serves on the community wellness and peer support team. And a little bit about Dion. She's the director of research, child and adolescent in psychiatry division at Georgetown. She's the co-director of the diversity, equity, and inclusion program, and also directs the adolescent dating project. Next slide, please. All right, here we go. This is Olivia. Olivia is on the Cross Systems Partnership team, and her work primarily focuses on early psychosis work groups. So she does a lot of work around that. Also, diversity, equity, inclusion in early psychosis and adolescent psychosis work group ongoing meetings that she's working on. And then I am Lisa. I'm new to NTTAC and excited to be here on the System of Care Implementation, Evaluation, and Sustainability team. So right now, I'm actually working on the fatherhood and father figures curriculum and working closely with Monica on just hashing this out and also making sure that we finalize a robust curriculum. Working with Victoria on the Project Director Series, so excited about that. We just had our governance training that Suki rolled out, and it was amazing. And also, I'm working closely with Ashley and Shane on the Universal Products Committee. We're excited because we're rolling out this scaffold pilot, and we're super excited about it. So more information will be coming about that. And that's all I have. Any more slides? Suki, was that the last slide? All right, thank you.
Yes, thanks so much, Lisa. And I am gonna, we've got 2 more partners that are gonna present quickly. I'm gonna pass it over to Linda Paul, who is gonna share about the American Academy of Pediatrics.
Hi, everybody. My name is Linda Paul. I'm Senior Manager of Healthy Development at the American Academy of Pediatrics, and I'm pleased to represent the AAP within NTTAC, where I serve on the Cross Systems Partnership Group. I just want to give you a little bit overview of the AAP and then the work we're doing with NTTAC. So the AAP is dedicated to promoting the optimal health and well-being for every child from infancy through young adulthood. We accomplish this mission through advocacy for children and families, professional and public education, research and development of evidence-based policy to guide clinical practice, and programs to improve child health. Each year, the American Academy Board of Directors determines strategic priorities for the AAP. For 2024, these initiatives are healthy mental and emotional development, environmental health and disaster readiness, equity, diversity, and inclusion, safety and well-being within the profession of pediatrics. And so you can see where many of these strategic initiatives align with the work of NTTAC. Next slide, please. So the AAP was founded in 1930 and is a nonprofit professional membership association representing more than 67,000 general pediatricians, pediatric medical subspecialists, pediatric surgical specialists, and trainees. Our members work in a variety of settings. The Academy has 66 chapters, which include the 50 states, the District of Columbia, Puerto Rico, and Canada. AAP chapters work to develop and implement statewide children's health policy, as well as address children's health care needs. AAP chapters are their own individual entities with nonprofit status and help to implement the programs of the National Academy. Our work is done with volunteers that participate in over 100 committees, council sections, and other member groups that engage clinicians with expertise and interest in specialized areas of pediatrics. These groups develop our policies, provide educational opportunities, translate policy into practice, and help to advance public education and advocate for child health. The AAP participates in a number of programmatic activities as well. Topics include social media and youth well-being, suicide prevention, relational health and trauma-informed care, pediatric mental health care access programs, and systems of services for children and youth with special health care needs and their families. We currently have about 500 staff. Our national office is located in Itasca, Illinois, which is just outside of Chicago. You can see we actually have a brick and mortar building, which you'll see there. And we also have a smaller office in Washington, D.C. Next slide, please. As a partner in NTTAC, the AAP serves in a bidirectional capacity to share NTTAC activities with AAP members, as well as share AAP events and resources with NTTAC. In addition, the AAP utilizes its role as a Project ECHO Super Hub to offer programming in partnership with NTTAC. Project ECHO, which stands for Extension for Community Healthcare Outcomes, is a telementoring program designed to create communities of learners by bringing together healthcare providers and experts in topical areas using lecture and case-based presentation to foster an all teach, all learn approach. As a super hub, the AAP implements its own ECHO and trains other organizations to offer their own. Within NTTAC, we train the other NTTAC partners on ECHO, as well as some other national organizations. And then in addition, the AAP is developed and is implementing its own ECHO program specific to anxiety and depression for pediatric primary care providers. We just launched our 4th cohort last week, and it has been very well received by participants. This current cohort offers a quality improvement opportunity for clinicians to measure changes to address anxiety and depression as a way to assess improvement. The AAP is very grateful to serve as a partner in NTTAC and to support systems of care for children, youth, and families. And with that, I'll pass it on.
Thanks so much, Linda. And last but certainly not least, I am going to pass it over to Molly Lopez to share about the work of the Texas Institute for Excellence in Mental Health.
And hi, everyone. My name is Molly Lopez. I'm a director at what we call TIMH, which is at the University of Texas at Austin. I'm going to be super quick because I know we don't have much time. But an amazing team that you get to see here. Stacy Stevens-Manser and I both serve as technical advisors. And then we have 2 wonderful family leaders, Adamina Tankersley, who has done a lot of family leadership in Philadelphia, has developed a family-run organization and has been a primary family leader within their system of care work. And Valencia Gensolin, who's also a family leader in Texas and has served both in the community and at the state level as a system of care family leader in that role as well. So our organization, if you'll go to the next slide, we are a center of excellence focused on really supporting across a broad variety of people how to implement recovery-oriented and culturally responsive best practices. As a part of this, we've been able to be a TA partner through 5 system of care grants, as well as supporting community organizations across our state in developing their systems of care. So really quickly, one of the things I thought might be nice to highlight, if you like to learn in different ways, we have a great new blog that's getting going that Valencia on our team shares her insights. It's going to come out monthly as a parent navigating systems. And I know she is looking forward to the opportunity to share from some of her experiences in ways that she's hoping may help your communities, your family leaders, and your families. So thanks. I'm going to pass it back.
I'm going to take an opportunity to ask you all to do something. We've been doing a lot of kind of like talking at and talking with. So now we are going to post a link in the chat to the CMHI grantee profile survey. And this is a really, really, really important opportunity. And so let me just say off the bat that this survey will take maybe, it kind of depends, but you can probably do in about 10 minutes, 15 minutes to complete the survey. But the whole purpose of it is not just so we can be kind of like all up in your business. That's not what it's about. It's really about collecting detailed information from you so that we can help connect dots. And some of those dots that we want to connect are among the, I think there's something like 83 CMHI grantees that exist right now that are currently funded. And so there may be other grantees that are, you know, having issues of like hiring or kind of staff shortages in rural areas. Wouldn't it be great for us to get, you know, 5 project directors on the phone that are kind of all having a similar issue? Or, you know, maybe folks are struggling with connecting to the child welfare system, and there's like 12 sites that are doing, have a child welfare focus. So we really want to use the information that you share with us to be kind of circled back and addressed and really help connect the dots for you to support you in a more tailored way. So we are really excited to ask you all to do this and excited to receive your information that you share so that we can make sure that we stay responsive to your needs. You can always just send us an email. I'll put my email in the chat. I'm a really good person to sort of have in your mind as like a single point of contact for your grant around system of care. You're also welcome to just email the general NTTAC email, which is in these slides as well. So, so just kind of a plug to please fill out this survey. And then thank you so much, Carrie, for putting my email in there. And really excited to help, basically help, you know, we're asking you to kind of help us help you in a really good way. So I'm going to pass it over to Victoria she's got a couple of really quick polls that we'd love to just kind of, speaking of supporting you, she's going to share more about and a new idea that we have for drop-in kind of TA office hours and sort of spot coaching. And before I pass it off, Victoria, I just wanted to share that in our role at NTTAC, we work very closely with SAMHSA to support you all as well. And so I know that many of you all have been participating in that learning series that they've been doing on a monthly basis. And so they're going to be shifting to those CMHI office hours that are also happening monthly. So I just wanted to distinguish that we're talking about something a little different, but has a kind of a similar title. So didn't want that to be confusing. So I'll pass it over to Victoria.
Yeah, that's great. Thank you, Suki. And so yeah, as far as filling out the grantee profile survey, like Suki said, we want to be able to learn more about you, to be able to better serve you, and to meet your needs that you have. So, when we were planning this presentation today, we were thinking about extended ways that we can make ourselves and the subject matter experts that serve on NTTAC and partners available to you all. And knowing that besides the office hours that SAMHSA is hosting, that resource that you have and the project director series, and all of the other robust offerings that we offer through NTAC, we wanted to offer, or had an idea, I should say, to offer a safe space where grantees can log in, either new or seasoned grantees can log in to chat with particular subject matter experts that may be available that day on particular topics. So for example, maybe it's logging in to talk about your evaluation strategy or your youth engagement strategy, or maybe it's governance, recruitment and implementation. And so we have a very short poll that we'd like your opinion on, and we could maybe send a little survey after to get the folks that weren't here on the format of these. And Carrie, I don't know if you could launch that poll for us. Okay, great. So this one is just gauging a little interest. Are you interested in attending these? Yes, absolutely. Maybe, depending on the format. Maybe depending on your schedule, and not interested at this time. Again, it will probably be likely informal, not a formal presentation, more to, like Suki said, tailored expert coaching in that moment for that time. You wouldn't have to stay the entire time, but it would be probably pretty informal. Okay, so we got a couple, maybe, depending on the schedule. That makes sense.
Is there a time, yeah, now we're seeing a lot of folks talking about your schedule, and I'm curious, is there a time, it's impossible to coordinate nationally and we have time zones and things like that, but just in general, if someone feels comfortable putting in the chat or coming off of mute to share, like, are you interested in maybe dropping in during a lunch hour, or you're busy all day and so something kind of late in the day would be helpful? Just kind of curious about scheduling.
Same.
I'm on Alaska time, and I assume most of you are not. So yeah, for me, end of the day usually works best, but that's pretty late for all of you, so that doesn't work the best. But lunch hour for me is probably end of the day for you, so that generally works well, at least on my end.
That's a great, thank you so much, Taylor. That's fantastic.
Yep.
That's super helpful.
Okay, so what I'm seeing here on the poll is that nobody is a definite no, right? So that's great news. Appreciate that. And maybe there would be some yeses if we had some times that worked for everyone. So we will hopefully think on that and think about some times that would make sense across the country, to see what we can do and offer for you all to just give you extra support where needed. So thank you. All right, so let's close this poll, and we're going to launch one more, and then I'm going to pass it back over to Suki to wrap us up here. Topics of interest, and this one you can absolutely participate in the poll, or you can drop some ideas in the chat. So right now in this moment, are there topics of interest that you'd like to see at a drop-in office hours? For example, we just had Suki do an amazing, incredible presentation on governance. Maybe she's available at an office hours and you come and speak to her. Things like that. And you can unmute if you'd rather tell us your ideas. Okay. I'm not seeing any answers on my end, and that is okay. I'm gonna just open up the chat and you can put those in. You can even private message me on the chat and we'll make sure that those get recorded. And of course, keep an eye out for possible future opportunities around office hours. So Suki, I'm just gonna pass it over to you with about 6 minutes left.
Great. So before I provide a little bit more detailed summary about some upcoming events and share those registration links in the chat, I just wanted to kind of open up to just see if there's any final kind of like questions or comments or anything that you all would like for us to know as we work toward kind of supporting you all in your work. So I'll just pause and see if there's any, what I like to call, I'm from the South, so I talk about biscuits and gravy. So I talk about like a gravy round. So it's sort of like, is there any last little thing that you all want to ask or let us know about? Okay, well, Victoria, if you can go to the next slide, I'm going to share just a couple of more events just to highlight. So there is a page on our website that I'll ask Carrie to drop in that just goes straight to our upcoming events. And so you can link to several, but not all of these events on that page. Things like some of the sessions that have a limited scope or like invitation only aren't on our website, but going ahead and bookmarking that upcoming events page is a great way to stay connected with things that are coming down the pike. So I just wanted to make sure that you all had this on your radar as project directors or LFCs to share with your staff. We have an evaluators community of practice. So this is specifically for CMHI grantees and the folks who are responsible for evaluation. And it happens every other month. So it's really good to kind of get in on that one. So, and again, Carrie's going to be posting all of these registration links in the chat, so you can go ahead and grab them. But the one for February is happening today. So I think it's the first Thursday of the month, kind of every other month is the schedule. And that is a really open forum for folks to just kind of come and bring challenges and questions and just kind of have that peer support element that we referenced earlier, specifically for evaluators or folks who are maybe like overseeing an evaluation committee or something like that. So Victoria already spoke about the Project Director's Implementation Learning Series. Absolutely fantastic series. So we're popping the link in the chat there as well. Millie spoke about the Family Exchange, which is a great opportunity to learn more and connect about kind of specific issues related to family engagement, family voice. Shane referenced the Yeah series. One thing we didn't talk about, these next two items, is we have a peers and clinicians together series called PACT, which is an open it's sort of a drop-in hours vibe, but it's specifically for clinicians or peers. And so Joyce, I'm thinking about you in that kind of like integration space. So it's just a really open place to just kind of come and ask questions. They'll maybe provide 10 to 15 minutes of a specific kind of content learning, and then it's just an hour. And then you can just ask any questions that you want. So it's a really great series and very, very informal. So it's a good way to just kind of, ask about maybe something that's been, an issue that's come up several times as a theme in your clinical practice or anything like that. We are also super, super excited to launch a new it's really like an open forum called Partner Platica. And Platica, if you don't know, in Spanish just means like chat. And so this is a place, it's a space where we are partnering with the Pacific Northwest, I think. Sorry, I don't know that. MHTTC. And we are working together to provide a space for Spanish-speaking clinicians. So if you serve Spanish-speaking populations or you have bilingual staff, regardless of clinicians, just if you have bilingual staff, just period, this is a great place to invite them to. I think it's going to happen monthly. There's a ton of resources that are coming out of this series. So even if you can't attend the sessions, I highly recommend that you register for them so that you can get the information on the back end. So really excited about that, and just kind of reinforces how we're trying to make sure that we're culturally responsive in the work that we do. And lastly, again, Ashley mentioned about the SOC Summit. So there's a link there. And on the next slide, there are some SOC resources. So you'll be getting links to these as well. I also have an eye on those workforce development and kind of workforce shortage issues. And I curated a list of resources for those as well. So I'll plop those, that link in here so that you can get those. Especially Joyce, I know you referenced that. Thank you, Carrie, for clarifying the Pacific Southwest Mental Health Technology Transfer Center. And so we are at time. So I just wanted to thank you all so much for taking some time out of your day to hear about this information. We will be following up with you all via email, and are super excited to meet you and your teams in Bethesda, Maryland this July. And yeah, so just thank you again so much, and just be on the lookout for follow-up emails with these links. And please do stay in touch, and we look forward to partnering with you in this work as we move forward. Thank you all.